Our industries are polarized right now. In fact, we would go as far as saying that this polarity has never been so stark and damaging to our respective professions. The overwhelming majority keep doing what they've always done, and their clinical outcomes never seem to change. We all know clinicians who have done this for decades. Even more worrying is when they aren't even aware that their clinical outcomes are so poor. Perhaps this is why the industry talks about patients regressing to the mean. This majority group has set the bar so low that even no treatment is producing similar outcomes. The good news is, there is a small but growing group who realize that this simply isn't good enough. They have a burning desire to get better outcomes for their patients and take control of their careers. With exposure to some of the toughest athletic and clinical environments around the world, and having taught thousands of people in multiple countries across diverse cultures and languages, we have identified three main areas that are holding clinicians back from improving their clinical outcomes. And we've developed a systematic approach to fill those gaps. The very first of these skills, and where we will start, is advanced palpation. The more advanced the palpation skills, the better you are able to learn and apply new techniques, and just as importantly, choose where and when each individual technique will be most effective. This is a totally different approach to the majority of clinicians who aren't even aware that a technique may work for one type of mobility problem, but not for another. At best, they use every technique they know, hoping to find the one that works. At worst, they just choose their favorite techniques each and every time, regardless of whether or not it produces a measurable and lasting result. We've developed a systematic approach to hone your palpation skills, to improve your skills, regardless of where they are right now. This approach has been developed by practitioners from different professions, so we know that no other course like it exists. We've taught it, we've tested it, we know it works. We've taught clinicians of all experience levels and all have improved their skills. We've even tested this system by teaching non-clinicians and proving that they can apply that knowledge within their own scope of practice. So why do you need to improve your palpation skills? Well, the fact is that palpation skills are fundamental for any clinician to treat mobility dysfunctions effectively. The better your palpation, the faster and more effective your hands-on treatments will be. Without functional mobility, your patient's movement control is blocked, which is why your rehabilitation exercises don't work as well as you think they should. And it also limits their ability to express their strength and capacity. It's like a racing car with a handbrake on. Which strategy would most quickly improve performance? Building a bigger engine or simply releasing the handbrake? It's much quicker and easier to release that mobility handbrake. Learn the steps to systematically take your palpation to the next level. Learn how to choose the right technique each and every time. Learn how to effortlessly improve your clinical outcomes. Join us at 4 p.m. Australian Eastern Standard Time on Saturday 30 May to learn the first of the three main areas holding you back as a clinician who chooses not to be mediocre.